Welcome to Coffee and Tea No C, where we sip coffee and spill the tea. Today, my guest is Dr. Amir with Plump Medical Spa. We had such an interesting conversation. We talk about everything from Ozempic to Botox and fillers to men's skincare to vaginal rejuvenation. We covered so many topics and it was a crazy conversation. Please welcome Dr. Amir to the show. Welcome to Coffee and Tea No C. Today we have Dr. Amir in the house.
They both took us, yeah.
How are you?
I'm doing well. How are you?
I am glad you came to do this with us today.
Absolutely, it's a pleasure.
Let's get into the interview.
Sure.
Were you born in America? Did you grow up here? Talk about your childhood.
So I was not. I was actually born in Iran, the capital, Tehran. So did most of my childhood there. Wasn't anything like a National Geographic or anything. It was pretty routine. Played soccer in the street with a plastic ball, chased girls on the side. And after graduating high school, I moved here, which started the college experience. And being a kid. It was fun. I mean, I was curious about everything. It kind of started the catalyst for medicine, I guess.
Did you have, because I'm Russian, I come from an immigrant family. Did they push you like you got to be a doctor, an engineer, or a lawyer?
I joke about it that when you just pop out of your mom, they look at you and they'll be like, you look like a doctor, you look like a lawyer, you look like an engineer, and that's what you're going to be. But I feel there was a little bit of a curiosity on myself as well. So, I used to carry like medical books, 1,000-page long. Didn't understand the word that I was reading throughout, but I would just do it, and I was like 10 years old. I had no idea what I'm doing. But science, human body, and all that does excite me, but it was a mutual decision between me and my family. So, I want to say they had a little part in it. So, yeah.
Okay. So once you start medical school, you become a doctor. When do you split to do aesthetics? Did you always know you were going to be in aesthetics, or were you like a doctor in a hospital for some time and then?
So the medical journey started with the plan to do something in the cosmetic industry. So even before I even went to medical school, I was really interested in cosmetics and beauty industry. And initially I thought I'm going to do plastic surgery. So that was the main goal. And then you get to medical school, you do your surgery rotations, and then you understand this is not the life for me,
Really? Why?
It's really time consuming. You're pretty much married to medicine. I feel like it takes a toll on your personal life. So you really have to make the decision at that time that are you going to do the sleepless nights? Are you, it's a lot of dedication. So it can take away from your personal life and your family life if you're doing any type of surgery. Plastic surgery may be a little bit easier, but I want to say all in all, it's a tough journey if you're a surgeon.
But I also feel like it's kind of a skill too, right?
100%,
like you have to be a good plastic surgeon. You have to have like an artistic eye for it.
I feel like in everything you have to be that way, but 100%. I mean, with aesthetics as well, but my uncle, he's kind of like a mentor for me. So he was a family physician. Then he opened the med spa right at the beginning of my journey into this. So I got introduced to the field a little bit early. So I'm like, peace out plastic surgery. Hello aesthetics.
Oh, okay.
And the goal was to do this. I just didn't know how long into the process. So after medical school residency, I did in New York. And then came back, worked at Palm Desert as an internist, outpatient for a couple of years, and then time came to renew my contract, and I told the CEO that, hey, this is what I'm planning on doing, which I feel like every doctor hates when they're saying you're going to into aesthetics.
Yeah. Really? Why?
If you talk to hardcore doctors, I don't think they really consider this true medicine.
Like they don't respect the profession, or?
I don't know if it's a respect of profession. It's just, I feel like, one, culturally, in a lot of cultures, maybe it's not acceptable. Like, in Middle East you have to be like a specialist, like nephrologist, cardiologist, and all of that. So, but I told CEO, I'm like, this is what I'm trying to do. I might come back in the month. Will you give me my job back? And he's like, yeah, for sure, go do it. And pulled the trigger, opened up, and it's been working pretty well. I'm pretty happy with the decision. Not going back. Not going back to regular medicine.
You opened up right next to us, right?
We
Our old
did,
coffee shop.
yeah. So, Hunter's Cafe. We can't plug
That
it
didn't
since
work out really
there you
well.
go.
COVID really destroyed us. Okay. So the medical spa. What's the name of it?
Plump Medical Spa. It's in Orange County, MacArthur in Maine.
Okay.
It's like by the corner of Irvine, Santa Ana, Newport Beach, and Costa Mesa. So it's a pretty easy access.
Yeah.
Obviously, the name in itself, it has description of plump, so it makes sense why it's called that. But it's
plump people up.
Yeah. Well, it started from a plump lip.
Okay.
But now it could be applied almost to anything because your skin has to be plump,
Right.
I guess, for it to be
Right,
healthy.
right.
And it started as a career decision, but I feel like it's really fun. So it's more of a passion project, so it doesn't feel like you're going to work.
Oh. Okay.
So I think of it really not as a job, as a passion project that you're just doing what you're really, really enjoying to doing day in, day out. So
that's cool.
yeah, I know you're trying to get into it too. So
I'm just doing Botox. That's all.
Right.
I'm starting with Botox.
Gateway to the aesthetics. So that's how you go.
Yeah,
right?
I know. Everyone's like, when are you opening your medical spa? When are you? I'm going to be doing podcasts inside my medical spa.
Actually, that's not a bad idea. That sound might not hit right, but
Okay, so what services do you offer?
So I think we offer almost all the services that are out there, almost, and there's a couple that we made the decision not to offer. So, we start with neuromodulators, Botox Dysport, Daxify, fillers, Sculptra, a lot of laser technologies from CO2, ablatives, fractional, IPL. We offer medical weight loss, which is a really hot topic right now.
We're going to talk about that.
Yeah. So I want to say almost everything that you can find that in the med spa that does not require a scalpel and cutting will do it, other than threads. On the record, not a big fan of threads.
I am not a big fan of threads.
Yeah.
I hate threads.
Yeah, so we're not going to offer that.
Yeah.
That's just not something I like aesthetically.
Tell me why you don't like it. Like, what's your rationale behind it? Is there the appearance or the scar?
So if it's done correctly, it can be nice. But I want to say most often it's not done correctly, and it gives you that really fake. If you look at someone, they had threads. That's one thing. Like, they're really just tight and pulled and
back.
just unnaturally. Just everything is just back here and like at the bottom. It just doesn't match.
Yeah.
Second, the risk of complication and infection is extremely high with these type of procedures.
Okay.
And lastly, because they produce scar tissue, later down the line, if you're trying to do a facelift, it makes it much harder for the plastic surgeon to find the right plane to actually perform the facelift for you and whatnot. So when you put that all together, it doesn't make sense to offer something that either down the line is going to be a problem, or aesthetically it's just not the most pleasing. When the
I heard that with filler, that the more filler you get, the more difficult it becomes. Like, when you do down the line decide to go get a facelift, it's hard. They almost have to scrape the filler off your face to lift it and put it where they want to lift it.
Depending on what type of filler you get, maybe.
Okay.
I want to say like the hyaluronic acid, the HA fillers, probably not. Obviously, you can't do fillers like 10 minutes before and then go do a facelift like the next day. But there are some calcium-based fillers that they do cause that calcification, scar tissue buildup around the areas that you're injecting.
Yeah.
Sculptra is a great treatment, but it can also complicate facelifts in the future because it does produce collagen in different planes, but not with the HA fillers. Not necessarily.
HA,
and you can hyaluronic acid, yeah.
Okay.
And you can dissolve them. So
Okay.
With fillers, no, I don't think so.
Okay. Um, what's the difference between a laser and a chemical peel? Say like you know me, you know I'm a nurse, I know these things, but say like I had no idea about aesthetics at all.
Hmm.
What is the difference between a laser treatment and a chemical peel? And why would one choose laser versus chemical peel and vice versa? Like why would you recommend one versus the other?
So both of the treatments is the aim is to improve your skin texture and improve the collagen production, right? So we're trying to remove all the superficial layers of the skin.
Mm-hmm.
One uses light energy in different wavelengths and forms, which goes with the severity of the treatment, and one just uses chemical agents, right?
Mm-hmm.
Um,
The laser is the
the light,
the
yeah,
light
the light, and
frequency.
yeah,
Okay.
chemical peel. I mean, the name is in it. It's the chemical reaction.
Right.
I don't. Does this get posted on YouTube? Because a lot of people are probably going to comment on this next segment.
Let them comment.
I'm not a big fan of chemical peels.
Okay.
If I had to choose which treatment to do between a laser therapy and a chemical peel, light chemical peels can be really good for complexion, pores, superficial. But if you're trying to do a deep chemical peel, like we see on social media,
Mm-hmm.
people are like peeling for days
Mm-hmm.
and all that.
But it's almost like that hard mask that they have you seen those on
Those,
Instagram where they have to take
those,
off
yeah,
the
but those are a very specific type of peel that you can't really find everywhere. You have to be monitored. They can be really
yeah.
they can be actually bad for your heart. Like you can have issues with your heart rhythm if you don't do it correctly.
Really?
I don't know if you saw this on TikTok, but someone actually died in Brazil like a couple days ago from a phenol peel.
Why?
So an unlicensed
What the fuck?
esthetician in Brazil did a microneedling on this guy that got really scarred,
Yeah.
and because it was painful, she put lidocaine cream on top of it and did a phenol um, peel on top of it, which requires for you to be on an EKG monitor. Like
Just because it's so severe, is
yeah,
that why?
it could be cardiotoxic. It could be bad for your heart, basically.
Yeah.
Like it
Yeah.
could give you arrhythmias. And the guy just went into a cardiac arrest and died. So,
Shut up.
not that I'm saying all the peels do this. That's that specific peel that you're talking
Yeah.
about that comes out as a mask. It's a
Yeah.
very specific peel.
Yeah.
But other reagents, if you're doing them correctly, fantastic.
Yeah.
But the ones that are really aggressive, like I see this every day that I did a chemical peel, I got burned or I got hyperpigmentation because I don't know if they're doing it for the gram or they're trying to like get social media attention, so they do it a little more severe than what you're supposed to do, and it can cause complications. But with laser, you're a little bit more in control of how much energy you're putting in based on the skin type, what level you're doing it, how if you're doing a fractional, what's your density of the treatment. So it's not really you're not just putting a thing in a
Like not solution
liquid.
on your
Yeah,
face. Yeah.
you're just doing it. You're actually going with technology, so it's much more predictable, and it's a deeper treatment in that way. Like a
Okay.
CO2 laser is one of my favorite go-tos.
Really? Okay.
Hmm.
So, like, you would examine a person's skin and decide
Oh,
chemical
100%.
peel versus laser, and most of the time you choose laser.
100%. Chemical peel, again, if you the thing with Plump Medical Spa is we don't do very superficial treatments. Like if you're doing skin treatments, yeah, we have it, but we try to give you more bang for the buck. Like if you can get the same result as 2 chemical peels in 1 laser treatment, that's probably the route. But if you're trying to just maintain, take care of the pores and all that, yeah, you can do like a light chemical peel, and it works. The light chemical peels are amazing.
I've done them on myself, and
Yeah, yeah.
yeah, I recently had like a hormone, I don't know what it was, but it just broke out all over, just on my chin, out of nowhere. And I usually
Yeah.
never, yeah, and I don't know what was wrong, but I did a peel and it kind of
See,
stopped
those are
hurting.
the ones that I'm saying, the light peels. You can do it yourself. Like, it's good. Your downtime is what, couple of days, 3, 4 days, a little bit
Yeah,
of a micro peel. But the
yeah,
ones that you see, like, people get
yeah,
super red and
yeah.
they're like, you can like peel.
Sheets,
What's the
yeah,
Austin Power, like golden, whatever, that you just pulls the skin
yeah,
off?
yeah,
Like,
yeah,
is what, I can't remember the character.
yeah.
Like, those are the ones that I'm talking about, that they can give you complications. But again, personal opinion.
Right.
Yeah.
Okay.
Yeah.
Um, let's see. I'm gonna give you some fire, quick fire.
Let's do it.
Deep acne scars.
Mm.
Laser or chemical peel?
Um, Step by step. If it's up to me, if it's depending on what type of acne scars you have, I actually do a subcision therapy with Sculptra, with or without Sculptra.
Oh, like a filler?
No, so subcision is, so whenever you get scars, you have these tetherings at the bottom of the scar of your skin. That's kind of like it's like a parachute connecting to the bottom layer. That's why they're like
Sunken in,
indented.
kind of? Yeah, 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 yeah.
Exactly. So with this treatment, you go underneath either with a cannula, which is like a blunt tip, or a needle, and it's called subcision. You move and release all these tetherings, like these little parachutes or these little kind of strings, for your scar to get released. And then you add a little bit of a Sculptra underneath these scar tissues to promote the collagen production. And then maybe a week later, after you heal, you come back. And my favorite for these treatments is something called, we call it Depigma, which is a combination of our Pixel 8 microneedling radiofrequency. Same treatment day on top of what we come and do a CO2 laser. If I had to pick what's the best route, this is probably the most effective treatment, that even one treatment probably going to give you like 40-50% improvement. And
And how many of those treatments do you need to do?
this is such a tough question because
It depends on how bad your face is.
well, to that, and different people respond very differently. Like, someone can do 2 of this and 80% improvement, and they don't need any more treatment on it. Someone can do it 4 times, and their acne scars might have been even more mild. So the severity, the person, how your body is responding to these treatments, home care is really important. So multifactorial.
Okay.
Yeah.
Burns.
Burns.
Like if someone has like whatever, a burn on their face and they're like, and it's scarred, you know what I'm saying? Or there's like pigmentation problems or, yeah, like a burn. Like
so with the burns, it becomes much more difficult because if it's a severe burn, you pretty much have a lot of contraction at the bottom of the scar tissue. So you have to do ablative therapy and superficially just remove layers and layers and layers. But at the same time, the response is not as great because you don't have that much healthy tissue underneath those layers. It's a little bit more of a tougher treatment. On the face, it responds better, but on the body, it's not an easy treatment to do. So you can do laser therapies. Let's say for the face, we say 3 to 4 times. You probably have to do like 8 or 9 treatments in order to get the improvement. But my choice would be ablatives, which is either CO2 or erbium, and you mix and match with other treatments in between.
sunspots.
Easier to take care of.
I have a bunch.
So your home regimen has to first be on point. So all these things that, I mean, there's so much information on TikTok now. So if you can pretty much treat everything.
You can be a doctor
Yeah,
just
exactly.
from watching TikTok, right?
But hydroquinone, vitamin C, like kojic acid, all these different ingredients can really help reduce the pigment, which we really recommend for you to be on these treatments for at least 2 to 3 weeks. Stop at 5 days before, do your treatment, and then get back on them as soon as you heal. So with sunspots, you pretty much can do, if it's mild, you can do IPL, which is it's a light therapy, not necessarily a laser, even though they all fall in the same category. or you can just do fractionated laser facials or Q-switch technology, which sometimes we use for tattoo removal. So depending on the severity, how it looks, how deep it is, you can use a variety of lasers.
Do you, with the sunspots though, like once you do all this work and you get them off, as soon as you go back in the sun, they're right back?
They
Is
can
there a
come.
way to not have them like not come back again?
Don't go in the sun. No, but it's true. A lot of these treatments, when you do them, they might look good, especially because we do most of these aggressive lasers during winter.
Yeah.
They look really good all the way to summer, and then summertime hits, and people are back in the sun.
In the sun, yeah.
Another thing is, especially with females, hormonal changes really bring out pigmentation as well. So, you can do the treatment, and even with on the monthly cycles, you can have your pigment getting darker and then a month later getting lighter, or a couple of weeks later getting darker. So they can actually change a lot with your hormonal changes as well. So
even if you don't do anything?
even if you don't, yeah.
Really interesting.
So
I didn't know that.
with pregnancy, you know how they say like your
Melasma.
melasma,
Yeah.
perineum, like different areas get darker. So the dark sunspots that you see can be reactive towards the hormonal as well.
Interesting. And wrinkles. I mean,
Easy,
I know.
yeah.
Easy?
I mean, yeah, compared to the rest of them.
Okay, how are you going to get rid of the...
I mean, what type of wrinkles are we talking about? Just,
like aging, like,
Yeah.
like regular aging wrinkles.
So, I mean, if we're using, depending on where it is, neuromodulators, Botox,
Yeah.
Dysport,
Yeah.
they do pretty much, if not 100% of the job, almost like 90% of the
Yeah.
job for you. If you've waited and you've never done these treatments, and then you're like 60 something and you're like, well, I want my wrinkles gone.
If you have static wrinkles already in your face.
Exactly.
Then
So
what?
if they're on the forehead and the frown lines, even though technically you can use fillers to improve them, it's a very risky treatment. I've done it, but I don't recommend it, because you have too many arteries around this area that you can cause vascular occlusion and necrosis. So I wouldn't say it's a go-to treatment. So if you can treat it with aggressive lasers, super hard CO2, you have a downtime of 2 weeks, but it will at least improve it. You can do that, but realistically, if you
You're
really
fucked.
have to and you really have to do it, you can use fillers for this.
Okay.
But again, I wouldn't go to anyone. You really have to know your anatomy and know what you're doing in order not to give someone, not to blind them or really mess up their skin. So,
Yeah.
But yeah, aggressive lasers, fillers, tox. I mean, we have them all.
What about like cancer scars? How about, would you approach that with, like, if someone had like a melanoma or something, you know what I mean, and they had it removed and they have like a gaping like area or like a white spot, you know what I'm talking about, where it's like discolored and it's just like a weird dot.
So it falls in the same type of category. If it's on the face, again, easier to treat. Going back, you can make lasers really aggressive and you can look like a burn victim for a couple of days and you can recover for 20 something days, or you can make it super mild. So depending on what you're treating, you kind of go in that realm to what technology you're going to use, what does it look like, first of all, and another important thing, what's the skin type of your patient. If they're lighter skin, you're way more open-handed on your technology and kind of compounding these things on top of each other in the same treatment. But if you're like from darker Middle Eastern, Indian, African American, as you get darker,
Asian too, I heard they
certain
their
Asian,
skin type.
Chinese, and Southeast Asians, so those are again tough. So you can't really do so much aggressive.
Do you know why? Do you know why that is?
Because of the pigmentation and the risk of post-treatment hyperpigmentation.
Oh.
So the lighter you are, the less risk you're going to have for post-treatment hyperpigmentation. The darker you are, one, you can actually take melanin away and destroy and cause hypopigmentation on their skin rather than hyper. But the inflammation can actually cause hyperpigmentation. It's kind of like when you get a scar, you see how it gets dark sometimes, or if you go in the sun, it gets darker. Same thing. You're causing damage to the skin whenever controlled damage to the skin whenever you're doing laser treatment. So if you're darker skin, that inflammation it's caused by that damage can cause hyperpigmentation and actually make the issue worse. So you really have to pick and choose based on a variety of factor.
So when you have like an ethnic
Mm.
patient, what's your course of action?
So the safest thing that we have that we can do if it's a superficial issue, we do the carbon laser peel.
Okay.
You've probably seen it on social media. They put a carbon gel and it's kind of like
Oh yeah,
so
and they suck it like
exactly. So the
upward.
carbon pulls out all the impurities from your skin, and
Uh-huh.
the laser energy, the heat kind of makes it explode, and it just creates the heat and improves the skin.
Mm-hmm.
It's a milder treatment,
Mm-hmm.
but because the carbon is already dark, it's
Mm-hmm.
getting a lot of that energy that's being introduced to your skin already, rather
Mm-hmm.
than all of it going to your skin. And another favorite is a fractional erbium. Um, on a low setting, it's kind of like Fraxel. It's
Mm-hmm.
like a mellow Fraxel.
Mm-hmm.
That can be safely done to like a skin type 5, like Indian, but again, African American skin, it's much more difficult. So
Mm-hmm.
pretty much you're left with the carbon only.
Mm-hmm. Um. So let's go back to the injectables, right? I feel
Mm,
like that's the most popular, right?
100%.
Botox, Xeomin, Daxify, Dysport. Differences between them? Do you prefer one versus the other?
So at Plump, we offer Botox, Dysport, and Daxify.
Okay.
They're all pretty much the same molecule with a little bit of a tweak. And that little bit of a tweak can change their personalities a little bit, right? So one of the big things that comes into play with when you're talking about tox as a after injection, one is the duration that it sits in the skin, like how effective it is. And then what's your diffusion percentage per injection point, which means
Like what the diameter is that it spreads.
exactly.
Okay.
Depending on how you inject, if you do like a 5 point on the forehead, that really comes into play because if you're just doing one area, you want something that kind of spreads out pretty well.
Mm-hmm.
But if you're doing like a microtox, a little bit less, but still, I think out of all of these, I think Daxify has the smallest diameter, then it's Xeomin, then it's Botox, then it's Dysport.
Mm-hmm.
I think they say like a nickel or a dime or something difference.
Mm-hmm.
And
Well,
Dysport,
I know 3 centimeters just because I just took the course.
there you go, there
So
you go.
Botox and Xeomin are actually pretty
Very
close together,
similar,
and it's
yeah.
about a 3 centimeter radius
There you go, yeah.
of the spread.
Yeah, and then Daxify is a little bit smaller of a radius, and then Dysport is a little bit bigger.
So Dysport spreads pretty
And
far.
that's why it gives you a little bit more natural. I mean, this, again, my personal experience and favorite is Dysport. I like it because it gives me a little bit more natural results. People still have movements, but you don't have those in between wrinkles that sometimes happen
Mm-hmm.
with
Like you cover the area pretty
pretty
well.
well.
Okay.
Yeah. So, but another thing with these, I mean, I don't think from someone that's getting the injection is important, but someone for business owners, it's if you can store them in the fridge versus not store them in the
Mm-hmm.
fridge. I feel like depending on what type of practice you run, that comes into play. If you don't have fridge space, Xeomin is a much better product than
Mm-hmm.
Botox because it doesn't
You don't have
require
to
refrigeration. Yeah.
Well, once you reconstitute, then
Well, yeah, one vial at a time though.
Right.
Like you can get your kind of supply and you can
Right,
store
right.
it, but if you have a small fridge or a small space, you can't put like
Yeah.
10
Yeah.
boxes of Botox
Right,
in
right,
there,
right.
But that's another thing that comes into play. But very similar. They
Yeah.
all last 3 to 4 months. Daxify does, studies show that it can last up to 6 months. I work with them, but I always even tell our reps, I only see it in 35% of the clientele that really get that 5 to 6 months of a push. It's usually around that 4 months,
Mm-hmm.
average with
Mm-hmm.
Daxify as well. So for people that think, oh, I want Daxify, it's going to last 6 months. Again, not everyone's going to get that, but in some people, yeah, it can last way longer than the rest of them.
Do you think it depends on their metabolism?
Metabolism, body, constitution matters.
Like how much they work out? Can they sweat it out?
you can't really sweat out the tox, but you can metabolize. Your body can reproduce those enzymes and proteins that causes the muscle contraction to come back fast. So
Mm-hmm.
if you're um, exercise does in a way affect it, but facial structure, how strong your muscles are, how much movement you usually have. Someone that's really super expressive, if you're just constantly moving that muscle, it's going to get a motion back.
Mm-hmm.
So it's multifactorial, but I want to say in general, probably 3 to 4 months is safe to say for almost all of them.
Okay.
Yeah.
Yeah, I feel like 4 months is like the magic
Yeah.
where you can kind of like start to see things come. Like I get it done myself, and I can see after about 4 months, I'm already like getting my wrinkles back. Like I'm already like, oh, I gotta go
See,
get
like
Botox.
for me, my eyes and upper forehead, 3 to 4 months is good. My frown lines and lower forehead, 2 months, maybe month and a half.
Really?
Yeah. So
You frown a lot.
I frown a lot,
You're
and
like
it's
super
just such
serious.
a strong muscle over there. I mean, for me personally,
Yeah.
like it just I have to touch it up in between, and that's something that people should understand because everyone thinks like you get Botox, it's just wrinkledness, all the wrinkles are gone, and then at 4 months it just drops. It peaks and it goes down gradually as
Yeah.
well. So your second month probably is the best, or
Yeah.
like at 6 weeks. Then slowly wrinkles gonna come back. It's not like you're gonna be wrinkle free for 4 months and then come back and do it. So
All of
if
a
you
sudden, it's like all or nothing.
yeah, so if you see things are coming back, come get touch ups.
Yeah.
Even though some people are not a big fan of this treatment and they say just wait for the full thing to come back, but I like touch ups. It keeps you more fresh throughout
Yeah.
the year. So
Yeah. Do you do your own? You
I do my own. There's probably a lot of videos of this online as well.
can you? How do you get into your eyes and like all the weird like? How do you really? You can do
The
it.
first couple of months was hard, especially which side is it? Yeah, since I'm right-handed, the right side of treating the frown lines was a
And
little
then
bit
how do you
high.
know the dose? Do you just know? You just feel
In
like
front of mirror.
oh, so you can see
So
how
you
much
can
you're
see the
pushing.
BD. Yeah.
Oh, okay. There. Wow. So you have a whole
Yeah.
system working.
Yeah. So I do my own face. I mean, I've probably done almost all the treatments that we have.
That was my question for you. If you
Yeah.
try everything on yourself.
I tried on myself first, like, just as a perfect example, we got a lip laser kind of device a couple
Yeah.
days, like 2 weeks ago.
Okay.
And even though I knew it's safe, I was the first one to do it. And then, my office manager, Ksenia, and
Yeah.
she's my other guinea pig for this. So,
Yeah.
and she's lighter, she's Russian, just like
Yeah.
you. So
Yeah.
I'm the darker skin
Shout
tone.
out Ksenia.
Yeah. I tried on my own as a darker skin tone, and she's a lighter skin tone. So I tried on her on a different setting to make sure that this actually is what the company says it is, and it helps to know the pain level, what it feels, what the recovery is. So when you're talking to someone, you're not just going based on companies
Like
two
what they
line.
said.
Yeah.
Yeah. So what is a lip laser? I've never heard of that.
So it uses a fractional erbium to remove the top layer of the
Lip.
skin on the lips.
Uh-huh.
So it brings out especially if you have hyperpigmentation on the lips. That's a big thing that a lot of people get under the sun. Like they get these dark spots.
Ah.
So it resurfaces the lip, and it actively promotes collagen production as well. So you do need more treatments. So it's not a one treatment, and it plumps up your skin, like your lip. If there's like before and afters that we have.
And it's like bigger.
It's bigger. So
Wow.
especially the first few days, but the more you do it throughout the year, the more it's gonna kind of show. So we do like a 6 treatment protocol in 2.5, 3 months, and then you're good for the full year. So you have natural collagen plump rather than filler. Doesn't replace it by no means, but for someone that doesn't want to do filler, they want a more subtle plump, and they want the pinker lip, like the color. It's a fantastic treatment. Recovers
Wow.
like one day. You have micropeel and dryness for a day, and
And then
that's
it's
it.
back to normal.
Yeah.
Wow, interesting.
But yeah, I probably the only thing that I haven't tried because it's so bright and I can't really see is IPL. Because it's just such a bright laser that you have to have eye covers if you're not.
Yeah,
so, other
Have
than that,
Ksenia do it on you.
on me,
Yeah.
That's not safe. You can't really have.
Set the machine, get everything
No, no,
ready,
no.
and then have her just go for it.
Let her do all her duties.
Administrative work.
Yeah, she doesn't need to get involved with the rest of it. Yeah, no.
What about filler? A filler favorite, and why?
I our partners at the moment are Juvederm, Restylane, and RHA.
Mhm.
Depending on where I'm injecting, I'm gonna have a different answer for this because, again, might not be a popular kind of idea, but I'm not a big fan of Juvederm. Voluma's good. Big fan of Juvederm Volox. I think it's one of the best for jawline and really contouring the lower half of the face. But when it comes to lips and other areas under eye, just cheeks, different things, I think for lips, my go-to is RHA.
Mhm.
It's a newer filler out on the market. It's been like 3-4 years already. But for lips, if you don't tell me what you want, that's my go-to. But if you
Mhm.
specifically ask, like you want Juvederm Ultra or Ultra Plus, whatever it is, we'll do that. It's fine.
Mhm.
It's completely good.
But how do you differentiate what you're gonna use? I mean, I get what you're saying based on the area.
Mm.
Is it because lips and like other places on the face you would want something that's a little more hyaluronic acid and plumper versus something that's a little more harder and like
Exactly.
more like
Yeah.
toothpaste type of
So
consistency where it'll shape and stay?
exactly. So Volox is like the hardest filler or the hardest kind of like bounciest resilient filler that you can have
Okay.
out of all the lines for Juvederm, Restylane, and RHA, or pretty much every other filler that's out here.
So that's good for like jaw
Right, when you have so much tissue that
or
needs to
like
be
chin.
lifted. Because you go on the bone usually and you need to lift a bunch of tissue. So
Yeah.
if it's something really soft and thin that, I don't know, you use for like under eye or
Yeah.
a very mild lip pump, I mean, a lot of people probably knew like Juvederm Volbella.
Mhm.
That's very soft.
Mhm.
Like if you put it in your jaw, even if you put 3 syringes, nothing's gonna
Not
happen.
gonna do anything.
So
Mhm.
depending on which area you are, how much water it's gonna absorb, what definition you want on, for example, let's just focus on lips. Do you want a little bit of a plump, like subtle, like you just got hydrated? You want a little bit less subtle? You want shape and form? You want to recreate a lip?
Mhm.
And then you go up the chain of what you're going to use. So
Mhm.
even with that, different products, different areas,
Mhm.
but I like all of them for different areas.
Mhm. Mhm. Do they wear off completely?
Let's just call them thin and thick, if it's for the sake of conversation, just kind of
Mhm.
going in. The thinner the filler, I mean, the softer it is,
Mhm.
the less time it's gonna stick around. The
Mhm.
the thicker the filler, the more resilient it is, the more time it's gonna stick around. So for lips, average 7 to 12 months usually. Even though I have a client that she's there every 6 weeks, and it's like a brand new lip that's never had a filler, and we put a half a syringe every 6 weeks, and it's gone.
It's gone
Gone, gone,
completely?
gone. It's like nothing.
How?
God bless her. I don't know. She has a really, really high metabolism. Yeah,
Jeez. It wears out.
I've never seen anything like that. We put a half a syringe, and we've tried almost everything. Nothing sticks.
Maybe she needs a lip implant.
Oh, well,
So she.
well, I'll talk to her about that next time. That's a little aggressive. But on average, I want to say 13 months is a good number to say for almost every filler.
Yeah.
But 9 to 18 months is the range, depending on what you're using. So
Okay.
if you do it once a year or once every year and a half, you should be okay. But it goes back with Botox as well. It looks good for the first 6 to 7, 8 months, and then slowly things are gonna kind of go
Yeah.
back
Yeah.
down. So touch-ups are important too.
Yeah. I would say I got my lips done, and I would say a year for me
Yeah.
before I really start to see that they've like subsided to a point where I'm like, oh, I like they really feel smaller.
You use Juvederm, right?
I think so.
Yeah. Okay.
I think so.
Yeah.
Yeah.
I mean, depending on the product, I don't know which one you use and whatnot, but yeah. Again,
Yeah.
with a lot of products, 13 months is a good number to say.
Yeah.
Yeah.
And she was playing with filling it on this side because when I talk, my lip pulls to the side,
Mm.
and I'm almost inclined to do a Botox injection in my DAO just to like straighten my to straighten my lip out so I'm not pulling to the side when I'm talking.
So DAO,
DLI.
DLI. So
Yeah.
that's the thing. DLI is gonna.
Yeah.
It's a tricky one.
Yeah.
But you can self experiment. For some people, it might actually work if they have that issue, but it can really make the.
Like if you know, like, do you know Katie Holmes
I do know her, but.
was married to Tom
Right,
Cruise?
yeah.
If you look at her talking on TV, she talking like this all the time. Like her lip
I
is
see what you're
always to
saying.
the side,
Yeah.
you know, like this. And so I feel like mine is too. And so I'm like, okay, let me think about this logically. If I paralyze this muscle, I can't. It'll prevent me. It'll sag this way. But then if I paralyze this muscle, then maybe it won't pull so hard this way, and it'll neutralize it so it's straight.
That's what I was gonna say. If you're gonna do it, at least do both sides so they both kind of get paralyzed rather than just doing one side.
You think so? You
Because-
think doing both is better?
So, next episode. Let's you let us know on the next episode how that goes. It's DLI is a really tricky muscle to mess with because they can really make the smile crooked.
Like I don't want to have a stroke-looking smile, right? So yeah,
But I would be interested to know too. So yeah.
I will let you know
Yeah.
how it works out. Okay, so maybe you can help us settle an age-old argument. Are Kardashian butts real?
Probably not all of them. I'm sure there's no way, even with the Instagram models and all that they say
Yeah.
they all go to the gym all the time.
Yeah.
I want to say 90% of the people that, if you think they have it, they probably had it. I don't want to say 100%, but 9 out of 10.
Yeah.
Was it real at one point with nothing in it? Probably. Is it real now 100%? Probably not.
Okay.
So I can't say 100%, but if I had
Do you do butt filler in your
Phil, we do Sculptra, like a butt
is it the
lift
hard
with
one
Sculptra.
or the soft one?
Different. It's a biostimulator. So Sculptra, it got introduced to the market in 2003, 2004 for HIV clients when they had a lot of muscle wasting in their face and they look really gonk and whatnot.
Okay.
For them to kind of inject it and produce collagens to make them skin more plump.
Okay.
And then it continued and became like the same material that we use in dissolvable sutures now. So that's why they produce collagen. They don't leave a mark. Like they heal much better.
Mm-hmm.
And it's pretty much, think of it as chopped up dissolvable sutures. So it's a powder that we mix with water and we inject it. It's off label in the butt. It's on label as cheeks only.
Okay.
I think
And it like helps.
yeah. So like the first day when you inject it, it looks fantastic, but the next day everything's gonna go away because the water gets reabsorbed. There's nothing there. It's just a bunch of little particles, and those particles activate the collagen production. And over the next 6 to 8 weeks, sometimes even 12 weeks, slowly, gradually, you build collagen. So let's say in a 30 or 40-year-old, you need 1 vial, 1.5 vial, 2 vials for the full face, if even 2 vials. 50, 60-year-old, probably 2 to 3 vials. In the butt, you need at least 10 vials per session. And you
Oh my God, that much?
And you have to do multiple sessions. You have to do once, and then you come back, you do another one in 4 weeks.
Oh my God.
But no
It's
downtime.
easier to work out.
Easier to work out, but for example, the hip dips, a lot of people don't have, they have that little hip dip that.
Yeah.
So for that, you can plump up the collagen production really well. Costly, but at the same time, no downtime. So you can go to the gym literally the next hour.
Oh,
Don't do that if you're listening. At least give it like a couple of days. But realistically, if you wanted to go for a marathon run right after, you can.
You can.
Yeah, there's no pain or anything.
So they're not real then, the Kardashians, huh?
If I have to say, probably not. At least not all of it.
Not all of the Kardashians?
No, not all of butts, like, percentage-wise, like, let's say.
Oh, okay, gotcha. Yeah. All right. What is your most popular procedure or service that you offer?
In general, not just for us. I want to say for almost every single med spa is the neuromodulators, Botox,
Botox.
Dysport, Xeomin, Daxify. But I know you want to talk about this at last, but the medical weight loss is almost becoming neck to neck over the last few months
Yeah, let's
with
talk
the
about it.
tox treatments because let's say in a couple of hours, if you're doing one tox, you're probably doing one weight loss as well. Um, so
Ozempic.
I'm a fan of Manjaro, not so much of Ozempic. But yeah, it
What's
just
the what? Tell me the difference.
so Ozempic is semaglutide. Also, we if we're talking about this, we got to also talk about all these Instagram semaglutide subscriptions that you see. None of these are FDA approved. Like FDA actually has warnings on these on their website that because semaglutide is patented by Novo Nordisk, so it comes in the pen. Only one company, one medical company in the world almost in the United States can produce these, which is Novo, which is the actual Ozempic or
Mhm.
Wegovy.
Mhm.
And then we have Eli Lilly, which produces the Manjaro, which turned into Zepbound after the FDA approval for weight
Mhm.
loss.
Mhm.
So Ozempic, Wegovy is semaglutide, Manjaro, and Zepbound, they're tirzepatide. Same family, both are GLP-1s, but the studies and in my actual practice with Manjaro, we get a much higher rate of weight loss. Side effects almost the same.
How? Yeah. Talk about the side effects, because I mean, I see so much negative information out there about it, because now it's like the gauntly face, and as soon as you stop taking it, the weight comes right off or right back, and you lose a lot of muscle mass, not actual fat. Like, what do you? How do you?
So the Ozempic face and the Ozempic butt as a nomer for all these GLP-1s, it's actually a thing, right? So when you're injecting them, they're not picking and choosing which areas that they want to, because basically the medication is trying to push your blood sugar down. They were diabetes medication. Your body is trying to keep your blood sugar higher. So in order to do this, you either have to use muscle or you got to use fat to turn it into sugar to keep this balance between this push and shove.
Okay.
If you have an abundance of fat, it's easier to go to fat rather than muscle and change that into sugar and keep that balance going. But if you lost a good amount of fat and you're really trying to push yourself, that's why they say sometimes it's not indicated for people, because if you're not really needing it, yeah, you can lose muscle because it's going to chip away a little bit from the muscle, a little bit from the fat, mostly from fat, let's say. But can it go to muscle? 100%.
Mhm.
And the Ozempic face, yeah, because you have a lot of fat pads in the face that's keeping your skin kind of
Mhm.
plump, and you're going to lose those as well. So overdoing the medication can give you these. Exercising with the medication can reduce that Ozempic butt and the flabbiness of the body that can
Mhm.
happen with it. So weightlifting and exercise is important, but I wouldn't call that a side effect. That's just a result of weight loss. Even
Mhm.
if you don't use Ozempic and you go on a calorie deficit and you lose 20 pounds, things are gonna drop down a little bit. Like your butt's gonna drop if you're not exercising. Your face is gonna drop because you
Mhm.
lost fat.
Mhm.
Same concept. So I wouldn't call that a side effect. Side effects are nausea, vomiting, constipation, diarrhea, and just tiredness.
Gastroparesis. Would you call it?
If you call it, well, they both medications do cause a temporary gastroparesis, which is the slowing down of emptying of food from your stomach.
Mhm.
So they both do that. That's why when you eat, you feel full for way longer. So one meal can make you full for 18 hours because it just sits there. It just slowly goes out. Can it cause permanent gastroparesis? 100%. There are cases reported on their studies, and there are cases outside that people talk about as well. But I want to say they're mostly dose dependent and length dependent. So if you don't need it and you're really pushing your body to do something that is not naturally required to do, you can probably cause permanent gastroparesis
Mhm.
on that. That's the thing. I haven't seen it. We don't. If you don't, we don't push people to that long and that much of a process. But nausea, vomiting, constipation, diarrhea, tiredness. I've tried Mounjaro. I've tried Ozempic myself. I probably lost 20 pounds probably on the medications.
Wow.
Um,
How do you feel nausea, tiredness,
So
and
that's the thing. I don't get any of them. I feel
really?
energetic. The next day, I actually feel better than the day before. I'm not kidding. I just feel super energized. No nausea, no vomiting. Don't think about food. Super clear minded because I'm not in a food coma. Um, but I don't. I mean, I do it like once a month if I have to at this point. But
Okay.
even if it's been a couple of months, but I did it at
Okay.
the beginning. But then again, kind of going to kind of like my office manager, Ksenia, she gets all of them, like
Really?
nausea, vomiting, constipation, diarrhea, tiredness. Sometimes like because the first couple of times she did it, she missed work the next day. We make sure that she's off the next day before she wants to start it because it really affects
She
her.
feels everything, right?
100%. And with clients, they can have a few. One can be more severe, one can be less. Someone nausea is worse, they don't throw up, they don't have nausea, constipation, or diarrhea. Someone's just diarrhea, very mild. It really depends. Bad way to say, but you never know until you try it
Yeah, yeah.
because it's not everyone gets it.
Can you predict? You can't
You
predict who's
cannot
gonna
predict.
have
No.
what side effects. It's
Well,
just
usually it's the people that say I'm very sensitive to medications, so you
then you know
probably
they'll
know, but they will surprise you sometimes too. They're like, nope, super good, nothing happened, fantastic,
really.
yeah.
So, what would be your like? I understand if a person is obese, and they really want to take it to lose weight. But if someone is like it's become super popular, everybody is on Ozempic, everyone is wanting to be skinny. Like if someone who's like me, for example, like I could probably lose 10 pounds. I should lose 10 pounds. But if I wanted to try it, what would be the duration of time that you would think would be safe? And then you should say, yeah, I should probably stop now.
So BMI, even though it's a really bad number in a lot of ways, is one of our guiding points. But also, your health in general is a guiding point as well.
Okay.
I usually don't prescribe the medication for more than maximum 8 weeks.
Oh, like 2 months.
2 months, yeah.
Okay.
6 to 8 weeks is usually my kind of like end. I'm like, take a break. I know you're loving the results, but take a break, go live your life, and then see how it is, and maybe we can do sporadically here and there, like 2 or 3 weeks, 2 or 3 weeks. Because no matter what, these are still diabetes medications. The studies, even though show weight loss, you don't want to be on this medication. You don't want to depend on this medication for your life, right? Um, with Manjaro, if your side effects are controlled, each week we increase your dose, or with Ozempic, both. In the 3 week period with Manjaro, I hate to say the word guarantee with it comes, but 12 to 15 pounds is guaranteed in 3 weeks. And
Of fat plus muscle, plus a little bit of muscle.
so I have this guy that he's been on it for a little bit longer. He's a much he was much bigger. He's 6'5", 6'6", and he was a big guy. He's been following up with one of these clinics that gets his muscle mass and gets his fat. He's been working out. His muscle mass, his fat loss, I think the body percentage is down to like 14%, and he's gained muscle. So for him, it's been working out. But it's really hard to just look at someone and be like, well, you might have lost fat or whatnot. But in 6 weeks, you can lose 25 pounds on these kind of medications. Easy.
Wow.
Yeah. Yeah. So
Wow. Can you undo the dance? Like if you get like gastroparesis or if you get whatever, can you like undo it?
gastroparesis is a rare complication of this. I mean, for example, for diabetes, gastroparesis, they put like neurostimulators and different devices and all that works. I don't know if it's coming back or not, but they're usually not permanent. Usually,
Okay.
they pump up your stomach. You get it for maybe like a couple of days. You probably end up in the hospital. They pump up your stomach. They put an OG tube. Get everything out, and then resting
Wait.
the stomach, and it
Yeah.
gets better.
Yeah.
I don't think it's a permanent issue with these kind of medication, but if you push anything to the limit, it can become permanent.
Yeah.
So
Yeah. So you're saying it's just not for like long-term use.
yeah, I wouldn't recommend these medications more than 6 to 8 weeks at a time in a couple, in the 6 months, 8 month period.
Yeah, yeah. So once you stop, does your like appetite come back with vengeance and you're like ridiculously hungry and you're back to like
If you're in the first 3 weeks, yes, because your stomach hasn't got small enough for the content to like, because if you're on this medication for 6 weeks, your daily meals are as small as a fist, right? And that's all you need for the day. So your stomach gets smaller. So by the end of it, you're not, even if you're hungry, 2 bites will get you full. But in the first 3 weeks, when everything's still there, yeah, even by 6th day, like you're good. You don't have any appetite for 3, 4, 5 days, and then 6th day, it just you wake up and you're like, I can just have a Domino's right now, just go at it. But it becomes less and less. And there's a thing, everyone's like, I read it on Reddit that you can gain all the weight back after you stop the medications.
That's what I heard. I heard that once you like stop, it just comes back.
But here's the thing.
And then some.
But it's calorie in, calorie out.
Right.
If you stop the medication, if you're not consuming the extra calories, you can't just randomly put the weight back. Like you can't just, just get air for it to become fat. So if you stop it and then you have not made any modification in your behavior and your diet and your habits, and you just say, I lost 20 pounds, I'm good. So let's just get back on the fast food diet and unhealthy life. Yeah, you're going to gain it all back. No matter what you do, naturally or unnaturally, you're going to gain weight.
Right.
But if you're not introducing 5,000 calories into your body a day, you can't gain it back, if you stick on a regular diet.
So, but if you're hungry, wouldn't you is your stomach shrunk and you can't eat as much as you used to, or?
So that's part of it, but at the same time, I feel like it's a motivation when you see you lost 20 something pounds and you spent a couple of $1,000s to get there. I feel like that should be your motivation not to gain it back as well, because these are expensive medications.
Spent all this money.
No, seriously, we could say, right, for 3 weeks is almost like $1,400.
Yeah.
Right?
Yeah.
That's a lot of money.
A lot of money. Yeah.
So if that helped you lose 15 pounds, that's like $100 per pound. That's almost. No, I'm serious.
No, you're right. You're right.
So if you've lost it, just make better decisions, because if you're okay with spending it every month, every 2 months, just you want to go up and down, be hard on your body and spend the money, I wouldn't recommend it, but you got to change the logic in this process as well for you to kind of stay healthy. The whole goal was to get you healthier.
That's the hardest thing to do. When I was a nurse in ICU years ago, we had a lady who was pretty obese, and she had 3 gastric bypasses because she kept stretching her stomach out. She would get the surgery, get skinny, and then start eating same eating habits, get fat, and then get the gastric bypass done again, and then get thinner, lose weight, and then it would just be like a cycle over and over again. And we were like, the
mental process,
of having to control your eating, or knowing that this is the portion control.
Yeah. So that's
it's hard for me even now.
It's not an easy thing, 100%, but I feel like you have to make the decision of what's more important. If food is more important, if that's a pleasure for a lot of people, food is a very big part of their life. And if that's a pleasure, indulge in it. But at the same time, being overweight, no matter how you look at it, body positivity and whatnot, being overweight is not healthy, right? Even if you're body positive and you're like, oh, everyone's beautiful in a lot of different ways, but being overweight can have health risks. So you have to think how much you care about your health, your image, and everything else. If you're getting a lap band and you're kind of going back to the same thing, you're making that decision. So I wouldn't say everyone's going to be the same. So, don't let a couple of bad apples kind of ruin the whole process for the rest.
So, with all the Ozempic injections that you've done, has everyone stayed pretty skinny?
100%. I can safely say 100%.
Your success rate is 100%.
Yeah. The lowest amount that someone has lost in 3 weeks has been probably 11 pounds, and the highest 22 pounds.
Wow.
But I have this conversation with everyone that you got to start changing, and I won't say almost all of them do. We do sporadically, when you get off of it, do one. If you tolerate the higher doses well, one thing that I do is you do the course, and then once every 6 to 8 weeks we do a high dose. So if you're a couple of pounds high, we just push you back down like 5 or 6 pounds for you to kind of stay in that range. But we do only one injection every 6 weeks or so. And one, it's not hard on your body, you lose the weight, but then it gets you back on the mindset that, hey, I got to keep this going. You can slip up a little bit, go on a vacation. Okay, fine, get another injection to kind of keep you there. But you don't need to be on this medication for the whole year every week.
Okay.
Yeah. I can't say I'm an advocate, but I like the results because people actually say, like, from their mental health, it has tremendously helped them as well. Because going back to the decisions, they start working out, the clothes fit better, they feel better, their relationship is better, their partner is enjoying it more. So it has other positive things that brings with it. But again, people have different ideas about this.
Yeah. What do you think is overdone?
Lips.
Do you tell people no?
100%.
Like, you're crazy, this is too much.
I sometimes don't treat lips because I have a few people that, I mean, there's no more room in there. Like, whatever you put in there is just not going to stay in there. There's no more room. So a lot of times,
DSLs, they're in style right now.
it's like well, one
So
thing,
if someone comes in and is like, I don't care, give me big lips.
I gotta put my name on that treatment. So
Yeah.
I would just be like, I don't think I'm the right person for you, because usually I say let's dissolve it, because a lot of people don't know what migration even is. Like, when you say, oh, your lips migrated, they're like, they're looking at you with this like a deer in the headlight kind of
Yeah.
look. Like, what do you even mean? What is? So then you show them, you see how your lip line just continues as a border, like a ski slope, just up to your nose, and there's no lip. It's just skin, and it's just one blob.
Yeah.
And they're like, oh yeah, now I see it. I'm like, yeah, so that shouldn't be like that. Remember, you had lip lines.
Yeah.
So I introduced the idea that let's dissolve it. If it's a HA filler, which most of them are, we kind of inject something like a Hylenex, hyaluronidase, take all the filler out. It takes about 10 days for the whole process, and then restructure it from the beginning. You want it big? Fine, we'll make it big, but let's just dissolve this and restart. For a good kind of, a lot of injectors probably not follow this, but I say every 4 to 5 lips that you do for the same person, it's best to dissolve and restart. It makes the lips much more natural and pretty in the
Okay.
long run, rather than just adding on top of the
Adding
filler
in.
and adding. So every 4 to 5 times, dissolve, just be lipless for a week, and then restart, and it will make the lips look much better. Less chance of migration as well, even though that's technique related, but yeah.
Yeah. What's the action of dissolving it? You just inject them and all the filler goes away?
Yeah, so it's just like a liquid. It's literally, you inject it and you press the lip, and you just feel everything just melting underneath your finger. You do have to massage it to make sure it goes everywhere, but it breaks the bond between the hyaluronic acid, so everything just becomes really flimsy, and then your body can easily digest and remove those from the area and then take them away. So you probably get 50% improvement right there and then, even though you get a little bit of a swelling, so it doesn't show as much. But within a week, your lips can go completely back to zero, like how they were.
What do you think is not done enough that you wish like people would pay attention to more, or as far as aesthetics concerned?
Not done enough.
Like, do you
yeah.
go to the grocery store and just like analyze people? Do you look at faces and you're like, they could use some Botox, they could use some filler, they probably need an IPL?
In my head, yes. Do I give unsolicited
just judge everybody
recommendation in public settings? No. I actually tend not to give any advice if it's not in the office, because, like I said, beauty is a very broad term. So something that looks beautiful in my eyes can look hideous in another person's eyes. That's why, like, people go to certain injectors, because they like the way they inject, and I might not like the way that person injects. Like, if you've been to Plump, you know I'm not a big fan of apple cheeks. Like, I don't like cheek filler sitting over here and for these two to be heavy. I'm more European to kind of lift it back with, the Russian
Yeah.
type of techniques
Yeah.
and whatnot. But is it ugly? No. If I feel someone has lost a lot of collagen up front, if they need them, yeah, but I wouldn't give them the apple cheeks. So for someone, this might be pretty, for another person it might not. So you can never give opinions about this unless they're in the office and it's a mutual conversation. You tell me what's wrong, I'll tell you what's wrong, see which one works for you, and then we can work on this. But I might say 5 different things and they're like, I love these are my beauty marks, I want to keep them. Great. You like them, that's all that matters. It's your face, you're wearing it. The beauty standards is what you think is beautiful. So it's really not an appropriate thing to just go and just be like, you need some of this and some of that, because it's really hard. Everyone's different. But one thing that I think a lot of people are not doing and they're not paying attention is neck and hand treatments. So if you look at someone's face and it looks flawless, skin is good, bright, tight, and then literally you come below the jawline and you see just lines and wrinkles and laxity, and then you look at their hands, it's just pigmented, all wrinkles and all that. You can guess the age very easily. It's just below is what the age is, above is what the work is.
Yeah.
So
That's a good way
yeah.
to put it.
Yeah. So
Above is the work, below is the age.
yeah. So you have to keep it in balance.
Yeah.
The neck treatment, I want to say, it's one of the most important things because it can tell a lot about what you're trying to hide, basically. You're trying to improve the aging and you're not focusing on something.
And how do you treat hands and neck laser?
You can do, for both of them, you can do late aggressive lasers for these neck tech lines. I see one over there. You can do Botox, right?
Yeah.
You can do injection Botox for the neck tech line, but you can also do very thin fillers or skin V, which is like a skin booster thing, right? Or if it's a skin laxity issue, you can do microneedling radiofrequency, and you can do Sculptra, collagen production. Same with the hands, and we can do laser from all the way up here, all the way down to take care of pigmentation and
Wow.
fillers, Sculptra, not Botox, obviously.
I'm doing a Nefertiti lift.
There you go. Nefertiti is
this weekend.
still not gonna hit the neck though. It's gonna hit your
I'm
jawline.
doing platysma, and I'm
There
doing
you
this.
go. Yeah.
Yeah, that would help.
Platysma definitely helps because part of the skin laxity is because of that platysmal band kind of pulling. But in the elderly, it's a loss of collagen and not having the scaffolding. So it's case by case. But I want to say never, if I have to give one recommendation, never forget the neck.
Okay.
Yeah.
That's good advice. Craziest procedure you've ever performed?
I don't want to say crazy, but the most out there treatment that we do is the vaginal rejuvenation with CO2 laser.
What? Talk about that.
Yeah, not a lot of spas do it. Not a lot of practices do it in general. But the technology got introduced for women that after pregnancy had urinary incontinence because of the laxity that happens within the vaginal vault.
Okay.
So what we do is with laser, it kind of goes in and does a 360 throughout the whole vaginal vault, and you don't have pain receptors in your vaginal vault, so it doesn't hurt. You're not going to feel anything.
Gonna say,
it doesn't hurt
ouch.
at all. You
No?
feel nothing until it gets a little bit closer to the entry point.
Okay.
That you might feel a little bit of a heat, but you have only pressure receptors in the vaginal vault. So you don't have pain receptors.
Okay.
So we laser it with CO2. So for lubrication, for tightness, for overall texture, improvement of urinary incontinence, and it can be life-changing for anyone. You would never have a negative review on this treatment.
Really?
Yeah. And
how interesting.
with one, 20%, with two, 50%, 60, 70% improvement after 3 treatments.
Can you change the way the vajayjay, like the hoo-ha looks?
From the outside?
Yeah.
Yeah. You can cause if you have dehydration of the skin and whatnot for the improvement, yes, but it's a very painful treatment.
Yeah.
So I don't know if
It's
everyone's
like
gonna go for it.
anesthesia, like full
Yeah.
surgery.
Yeah.
Like
So for labiaplasty and all that, yeah. But if you're just trying to get the skin, I mean, we do IPL for whitening of the skin, right? If you have pigmentation, darker pigment, and you want to go lighter, IPL, it's tolerable.
Yeah.
But for changing skin structure outside,
yeah,
that's painful. I
yeah.
don't have a lot of people just line up for that. No,
Yeah, yeah. I would
surgery would be a
imagine I
better
just would
option.
Go get my badge whitened or something. That's
That's
crazy.
that's not painful. That's not too painful.
Really?
Yeah, yeah, yeah.
How do you know? Do they tell you?
One, I know which procedure is painful because I see people jumping around or just be like, I need a break. They do say on the IPL, like the vaginal IPL for skin lightening, they do say I need breaks compared to rest of the areas that we treat.
Do you like numb it or anything?
We numb it, but still, you have a
Still,
lot
it
of
still-
nerve endings outside,
Yeah,
not
yeah.
inside. But
Ow.
yeah, it you know, that's, I wouldn't say that's probably the most out there treatment that we do.
Yeah. Wow. Oh my God.
Mhm.
Are any cosmetic procedures covered by insurance?
If it has a medical underlying reason, yes. You know, a simple example is if you have breast cancer.
Mm-hmm.
If you go get a mastectomy, pick your plastic surgeon. They're actually going to do a reconstruction. Most of the time, they'll do a reconstructive plastic surgery right after, and that's probably covered by
By
insurance. Or if you have a significant destruction from like a skin cancer, and it's giving you pain or kind of contraction on your face and whatnot. So if it has an underlying medical reason, yes. Like I know a lot of girls have done this, that they go for a deviated septum and then they come out with a little bit of a baby nose job. That's
Yeah.
a thing
Yeah.
because they're trying to correct the deviation, but they can still chip away a little bit from the nose as well.
Yeah.
So I'm not saying anyone should do this, but that's one way that
There
I've
are
heard
ways, there are ways around it.
that people do this.
What about explanting? Do you know anything about that?
Explanting of what?
Breast implants.
It's becoming a much more popular treatment and idea because of
The BII, breast implant.
yeah,
illness.
the illness, the inflammation. It's mostly with the really older breast implants, like the material that they use, that you can sometimes see it gets hardened and calcified, like they when they remove it, like it's an eggshell, like you can crack
Yeah,
it and open it.
like a capsule.
Yeah, exactly. I want to say not everyone gets this, and not everyone has those chronic symptoms that it can come with it, but it's not my realm of practice to say. I don't have enough knowledge on this, but is it something common that we hear about a lot? Yes. Does it happen to everyone? Probably no. But a lot of people are actually tending towards more natural looks. So earlier in the 2000s, probably bigger breasts were much more popular, even though they're making another comeback. Yeah, there you go.
Hi. That's when I got mine done.
Yeah, so people are trying to be less implants. It's becoming a thing. So, but I mean, to each their own. If you want to take them out, why not? Some people take them out and put another one in. So.
One last topic before I let you go.
Tell me.
Aesthetics for men. Had a few men reach out with some questions, and like say a guy walks into your office and they have never had Botox, they have never had any procedures done, but they're maybe hitting like mid-late 30s, early 40s, and they're starting to notice some aging. Like, where does a guy start?
I feel like the idea of cosmetics and taking care of yourself is becoming a more acceptable thing for the male population.
Hello, we're in Orange County.
Right. But even in Orange County, you'll be surprised. Like, even at our spot, probably like 15% is male. Like, it's
Really?
not, yeah, it's not, I feel
Not
like
as many as you would.
you would think with everything going on. Because, one, I think they're not educated in this, because if your girlfriend's like, oh, you got to get a job, you're not going to listen to your girlfriend. They're not educated that it's not going to like make you look like freakishly weird, right?
Yeah. Well, my husband, I had to drag him to get his first Botox.
Right.
He was like, no, no, I'm not doing. But after he got it done, he was like,
yeah,
wow,
absolutely. So
I look good.
that's the thing, because you see the positive outcome of it. So
Right.
I want to say until the first treatment, they're going to be skeptical.
Right.
After their treatment, they're actually going to, they might be there more often than your females sometimes.
Right.
Like I have a few that come every 3 weeks or so.
Okay.
And they do a range of treatments, and because they care, they want to stay younger. They're more in the spotlight a little bit. They social media, this, that. So they want to look good in the long run. But we're not changing their masculine characteristics unless they want to. Someone will come, a male, they're like, I like more feminine features. Fine. That's what we're going to go with. So, people have to have this understanding. You're not changing who you are. You're just making it a little bit more fresh.
Okay.
Yeah. But Botox is a big one. Skin Vive, which is a skin booster, it's a fantastic treatment for men. Laser therapy is for everyone. I probably do one every 3 weeks for myself. So that you should absolutely take advantage of, because your skin's going to love you and you're going to stay healthy. You're going to have healthier skin for longer.
So when they come in the office, do you just kind of get like a gauge on what they're trying to do? What they want
So
to...
we always do a consultation, no matter if you're male, female, whatever. Because, again, I can't tell you what to do. I can guide you through these are the things that we can do for these issues, but if these are not issues for you, we're not going to do them. So
Right.
you tell me what you think, and I'll give you my professional judgment on these are the things that we can change.
Right.
Now, from this list, which ones are important to you? And then if you say this one and this one, and you didn't pick another one that kind of connects with each other and it's going to make a difference, I would say let's do this as well. I'm sure it's going to go in the kind of direction that you're looking for, because if we don't, then you're not going to get the full satisfaction of the treatment. For example, some people say, I just want my forehead done. You got to treat the frown lines with this. They're two opposite
Net
muscles.
lift.
Yeah, so, simple example. So I'll say let's do both of them, but you're going to be happy, right? And we're not going to touch anything else. And then they do that. Okay, let's do the eyes now. So it's, gradual build up on that. So, yeah, but you got to listen to your clients, because they're the ones kind of going through life. Not you.
Right, right. Okay, what about skincare? Like when it comes to skincare, what if you had to choose the most simplistic? Because I have a skincare routine, and I have like 5, 7 different steps that I do: serums and sprays and oils and da. And he doesn't want to do any of it. He's like, all this bullshit, and I don't know what it means, and I don't know. So if you had to like choose the most essential steps, what would be your top 3? Maybe?
Guys will be guys, so
Yeah.
you cannot force them.
Like
if they're
he just
not
puts like lotion on his face, on his tattooed
yeah,
arm,
yeah.
and that's it. Like not even the other arm. I'm like, dude.
I can understand that,
Okay,
100%.
so like break it, make it very simple.
If I had to give, the most important is washing your face.
Yes.
I know a lot of my friends that don't even wash their face until they get into the shower. Even if I don't know if they wash their face in the shower. Like I'm not kidding. Like they don't have a face wash. It's just whatever water is coming down. It's just
same shower gel.
Yeah, it's just so washing your face at least twice a day is very important. So invest in the face wash.
Okay.
Basic.
Okay.
For men in their late 20s, 30s, one thing I strongly recommend is a retinol eye cream.
Brandon, you listening?
Yeah,
Okay.
retinol eye cream is a must, because it will reduce the pigmentation around the eyes. It will plump up the collagen, so everything will look much more smoother, much more lighter. So there was a makeup technique that girls were doing like a couple of years back, or Donald Trump. You know how his eyes are just wider?
Yeah.
And
Yeah.
you can do that with retinol,
It's called
right?
baking. Yeah.
Right. That part I'm not too educated on. But it's just going to make your eyes lighter and more healthy. So
Okay.
retinol eye cream, I want to say, is a must for everyone. If you're in the early 20s, probably not. But a mild acid and a mild retinol or vitamin C. You can choose either or.
Okay.
So if I have to say wash your face, put on some retinol eye cream, and then pick and choose your day. Either do vitamin C or do a little bit of a mild acid once a week or twice a week, like a salicylic acid pad, BHA, AHA pads, um, or
Okay.
pick a retinol. It doesn't have to be complicated. Honestly, moisturization and SPF. Well, that
Yeah,
makes it really
moisturizer, right?
complicated, actually, now
Yeah.
that I think
Okay,
about it.
so wash your face. So face wash.
Mm-hmm.
Retinol.
And then you can get a moisturizer that has already SPF. So it could be
Okay.
3 steps,
Okay.
right? Wash your
Yeah.
face, retinol, eye cream, and then put a moisturizer with SPF. If at nighttime, pick between a vitamin C and a retinol for your
Okay.
general face.
So you would say vitamin C or retinol, like you can toggle between the two?
Well, what are you trying to achieve? If you have a lot of pigments, even though both of them can treat, but if you're having aging skin, retinol is better. So
Okay.
talk with your girlfriends. Honestly, talk with them. Be like, pick 3 things for me, 4 things, and just say, do this at night, do this in the morning.
Retinol is for brightening
Brightening and
getting
collagen
rid of
production.
and getting rid of spots, right?
Yeah. So,
And retinol is for resurfacing the skin.
so I think you said retinol twice. So yeah, vitamin C mostly towards pigment.
Okay, yes.
So everything dark spot vitamin C. So you want to lighten it, but I wouldn't use vitamin C around my eyes. That's not. I mean, I don't know if there's vitamin C eye creams, but not for your face. Also, don't use the retinol for your face for your eyes. And like Jason, it does not fit all the areas. Make sure eye is a very sensitive skin.
Okay.
So you want to make sure whatever cream you're using is eye focused.
Okay.
But retinol will give you brightening and collagen production. Vitamin C will give you lightening your skin for pigmentation. And acid, if you have pores and oiliness, I do. Like acid is part of my almost every other night routine. A mild acid like a BHA, AHA, pad, serum, whatever form, if you have pores and if you're oily. If you're not, it will dry you out. Don't use it.
Okay.
Yeah.
Okay. And moisturizer
Yeah, and
with SPF.
yeah, if you can bundle up in that one product, you
That's
guys
a
can.
lot of steps, Amir.
I mean,
I feel like we started.
yeah. So here's. Okay, I'll give you a recommendation on my own skincare. I have a medical skincare
Yes.
line. Yeah, Botanic Noir.
I wanted you to bring it today so we could talk.
Yeah.
We could talk about products.
So, on the Botanic Noir, I don't use anything else other than the Botanic Noir
Yeah.
products. So for me, is the retinol eye cream.
Yes.
It's our pore reducing the salicylic acid pads.
Okay.
Every other night, and our SPF, the zinc SPF that we have, which is a
Okay.
moisturizer and SPF.
Okay.
I personally don't use vitamin C that much and whatnot, only because I do a lot of laser treatments.
Okay.
If you're not doing a lot of laser treatments, invest in the retinols and the vitamin C. But if you're taking care of your skin medically, there's no need to dish out like hundreds of dollars on skincare products because you get way more results with the actual practice. So that's why I don't use any brightening agents that much.
Yeah, because you don't really need to,
Yeah.
right? Does like starting Botox, does age matter when you like for men specifically too? Because I feel like most girls, ladies, females, women tend to kind of, they know all about it and they start that type of treatment earlier. Like I feel like 30s, even 20s now.
I have clients that are in 21, 22. They're starting.
Yeah, they're already doing Botox. But for guys, especially, like if they were interested in it, does it matter when to start? The sooner the better.
I would say when you see those wrinkles are not going away without facial movement. So and especially hopefully they're in the faintest kind of period of their life, right? So if you see your forehead or around your eyes, you're getting lines that without any motion, they're still there, or they're starting to appear, that's the best place to start.
Time to
Yeah.
call Ghostbusters.
Yeah, exactly. Because you can prevent a lot of headache, because if they become permanent, it's harder.
It's
So
harder to get them done.
you can get them at 30, you can get them at 21. So if you see permanent lines that are starting to build up, that's the right time to start.
Okay. What is your best kept secret or maybe a key to anti-aging?
For me personally, is a lot of people say I don't believe like how old you are. Monthly laser treatments.
Really?
Yeah. So I do a semi-aggressive laser treatment every month.
Okay.
recovery 4 to 5 days. So that's my secret, if I
Okay.
have to say. Try to do not the laser facials. There are a lot of chains that offer laser facials and all that. They're pretty gimmicky. They don't do much. You need a little bit more. If you're not red for 48 hours after the treatment, it's not doing anything for your skin necessarily. So do a little bit of an aggressive, just take a weekend off to yourself and then keep your skin looking young.
Yeah.
Yeah.
So laser.
Lasers, if I have to say. If you're doing a well-kept secret. Botox, you would know. If you're 40 and you don't have wrinkles on your forehead, you know they're getting Botox.
Yeah.
There's no way. Or fillers, you can kind of tell if
Yeah.
but if someone's getting laser treatments and their skin looking good, no pigment, their skin's looking just more refreshed.
Yeah.
They're probably using good skincare at home.
Yeah.
You wouldn't know.
Yeah.
So good laser treatment, monthly treatment is a good, solid answer for that.
Yeah. That's awesome.
Yeah.
I'm gonna take that advice. And get in there for a laser treatment.
There you go. You've been saying that for like 2 years now.
No, I really need to do it.
No, seriously, she's been saying like, "Oh, you have this new treatment. I want to come see you." I'm like, "We're 2 doors down from your cafe." Just like, "Yeah, next time." I'm like, "Okay." Then she's like, "Let's go get dinner." When? Next time. It's like, okay.
Thank you so much.
Very welcome. It's been a pleasure.
Pimp yourself out. Tell everyone where they can find you, where's the spa located, talk about your locations, your skincare, everything
Yeah,
that
so
is Dr. Amir.
we just opened our second location in Rancho Santa Margarita 2 weeks ago, so we're pretty happy about that. It was a process, but our main one is right down the street from John Wayne Airport on MacArthur and Main in Orange County. All our handles are Plump Medical Spa, the full thing, www.plumpmedicalspa.com. We have 95% of the treatments that we do with description, with prices, with purchasing options online. You don't even have to come to the spa. If you have a special, you can just purchase it online and just leave it there and use it whenever you want it. All of these things are on our website. But if you want to see the procedures, get a little bit more understanding of the vibe and the before and afters and what we do, the Instagram is going to be the best, plumpmedicalspa.com. For the skincare line, female or male, it's a clean medical grade skincare, so it's way more stronger than what you can get over the counter at Target or whatnot. It's Botanic Noir, again, same handle, Botanic Noir for Instagram and Botanic Noir for at the website. Other than that, come get a free consultation and let's talk, That's about it.
That's awesome.
Yeah.
Thank you, Amir.
Thank you. It's been a pleasure.